I'm Dr. Craig Escudé, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to this episode of IDD Health Matters. We have a special guest today, Dr. Julian Trollor. Dr. Trollor, welcome to the show. And you came a long way to be here. Truth is, he didn't come a long way to be here. He's here for the American Academy of Developmental Medicine and Dentistry Conference, I'm just fortunate enough to have the opportunity to have you on the show. So tell us a little bit about what you do in the field.
Craig, thank you so much for having me. It's a pleasure to be with you today. I'm a university academic at the University of New South Wales in Sydney, Australia, and I'm a clinician. I work as a doctor in the field of neuropsychiatry, where I provide clinical care to people with intellectual and developmental disability and complex needs. Most of the research we do is really building better capacity for our health services system to respond to those needs.
So how did you come into the field of working with people with intellectual and developmental disabilities?
It was a long journey. I knew I was interested in neurology and psychiatry from an early phase of my medical career, and I quickly managed to have a training job in psychiatry. Thereafter, I trained quickly in neuropsychiatry before taking on a job as a staff specialist in a big tertiary centre that was a neuropsychiatric centre. Some of the work there involved assessment and giving advice around complex care management for people with intellectual and developmental disabilities. So I developed that natural interest. As time went on, our government decided that it needed to fund a specific academic chair to build better capacity in this area. And I was really fortunate enough to take on that position at the university and maintained a bit of a clinical role as well.
So I know you do a lot of research in the field. Are there some particular areas of research that you focus on?
Our research is, I think, best understood as inclusive research. So we co-design research with people with lived experience. We conduct that research. We then show the results to people with lived experience and ask people what they'd like done about the findings. And this makes sure that we complete a research cycle, firstly doing research that is of benefit to people, and then understanding how we can apply that.
Yeah, that's such an important part of it to include people that this research might impact or affect in the whole process.
Absolutely.
Yeah.
So it means that the research has to be multidisciplinary in nature, but it also has to be varied. So some of the research is around the population health needs of people with intellectual and developmental disabilities, and then some of it's much more experiential, really understanding from the perspective of people with intellectual disability and those who support them, what their experience is in healthcare.
Yeah. So you also provide clinical care, and you mentioned neuropsychiatry, right?
That's right, yes.
More neuro, more psychiatry, a good mix of both?
It's a real blend, and it depends on what the person needs. Often we're reviewing people who have quite complex needs around either diagnosis, where the diagnosis might be unclear, or management, where there might be confusion or difficulty navigating a path, or a person may have a condition which isn't well treated or controlled at present. So depending on the emphasis of the clinical situation for the person and their needs, the emphasis will either be on more the mental health or behavioural aspects, or more on the neurological side of things.
And sometimes it can be pretty hard to tease those things out.
That's
I know
right.
from my own experiences that can be a challenge.
Absolutely.
Yeah. So as I mentioned, we're here at the American Academy of Developmental Medicine and Dentistry Conference in Denver, and you are the leader of a similar organization in Australia, right?
That's right. We have a similar but much smaller organisation called the Australian Association of Developmental Disability Medicine. And it's a...
ADM, right?
ADM,
Yep.
yeah. So it has the similar initials of your organisation. It's very small. Most of our members are doctors, but we also have allied health professionals as members as well. At this stage, we don't have a dentistry collective within that organisation, but we do have special needs and special care dentistry organisations in Australia.
So what are some of the things that your organisation is working towards in Australia?
A couple of the key points of our work are really advocacy, to ensure that our government and policymakers are aware of the health gaps for people with intellectual and developmental disability across the lifespan. ADM over time has played a pivotal role in really taking to government a number of important points. And early in its life, ADM was central to the embodiment of health checks in our national health system, so that funding was obtainable in primary care settings to undertake annual comprehensive health assessments. ADM has also had a pivotal role in ensuring that key national initiatives, such as the new National Roadmap on healthcare for people with intellectual disability, has become a reality, and has made sure that over time government pays more attention to this area. As well as that, we also focus on encouraging our colleagues in this area. So one of the key things ADM has done over time has been to host conferences, not as big as your conferences here, but to try and host conferences that help us have a collegial atmosphere and exchange of knowledge that really helps our profession grow.
So one of the focuses that we have here is to try to instill education into training programs for medical schools and dental schools. Is that the reason is because there's such a need for that. I mean, there's a lack of training. How is that similar in Australia or different?
It's interesting you ask that question. Over time, a number of audits of curriculum have been done. A few years back, we completed a national curriculum audit of medical schools and nursing schools. And about 20 years earlier, a colleague, Nick Lennox, and his colleagues had completed another audit of medical schools. We found that there's very little content related to the healthcare needs of people with intellectual disability in Australian nursing and medical schools, and very little direct exposure to people with lived experience. Interestingly, when we compared that with the picture that Nick saw 20 years ago, there was no improvement. We've then lobbied hard to ensure that this is one of the key priorities for government, and we're really fortunate that just in the last few weeks, our government has funded the next phase of a curriculum development project, not just for future doctors and nurses, but for all future allied health professionals and dentists. And we're really excited that my group is leading the development of the toolkits and the resources to make sure that that happens.
That's fantastic. That's fantastic. So, as we think about, or as I think about training in the field of intellectual and developmental disabilities and the need for that, when we train people to take care of some of the health needs of people with intellectual and developmental disabilities, there's a real spillover into other areas of medicine, I think, as well, too, especially people that are aging, people that have dementia. Many times there are some similarities in some of the health differences or challenges that we see. Would you agree with that? Have you experienced
Absolutely.
that as well?
It's one of the key arguments we've used, in fact, to enhance the curriculum in this way, indicating that doing so will benefit not just people with intellectual disability, but a much broader range of people who experience some degree of cognitive disability. And if you think of the statistics, that's a much larger group of our society. Of course, curriculum space is really difficult to find.
That's one of the challenges.
And indeed, this argument then becomes very important. Well, how is this benefiting beyond the small group that we're speaking about passionately? And I think we've finally got that message across.
Well, it's interesting, some of the similarities, no matter where we are in the world, we're really facing a lot of the same challenges and trying to work through those challenges and very much in the same place. And I think back when I found out about this organization. I knew, well, when I started working in this field, I knew very little about providing healthcare to people with intellectual and developmental disabilities. And I didn't know that I even needed to know it until I began working in this field. And then I realized, wow, okay, I've got a lot to learn. And that, I think, for me, is one of the biggest barriers that I see is sometimes when we approach a clinician or an organization, one thing is, well, why do we need to know this? Because, we talk about genetic conditions and we teach those things, and it's much more than just understanding specific genetic conditions. There really is a different approach that's needed to provide good health care for people with disabilities.
Indeed, it's a much broader approach. And I'd say one thing that we've understood from people with lived experience is just how important it is to start from the fundamentals of how do we include a person with intellectual or developmental disability in their healthcare journey? How do we engage them to the greatest extent possible in our healthcare consultations? And how do we make sure that we have them at the centre and involve others to support that journey according to their preferences? So it's very different from just simply thinking in categories such as a particular genetic condition. It's a whole approach in healthcare that's really inclusive.
So let's talk about the time you've had here at the conference. How has it been?
It's been an incredible time of learning. It's been inspiring for me to hear so many exciting things happening in our field. I'm left with a sense of needing to somehow connect all the dots. I've heard so many excellent initiatives, and I hope that I can retain some of that information and connect further with people from when I get back home. But I also think that what's been highlighted for me is that a lot of people are doing very good work in this space, but we don't have a way of readily cataloguing, sharing that information, or being able to quickly search so that we can find those resources again and make use of them in our own patch. It's got me thinking about how we can do international collaboration differently.
I think that's the next step for sure. Is maybe we all have some international reach within our organizations, but maybe an official international organization might be a step to take.
Yes, and there are ones that have certain positions or certain functions at the moment, including those research bodies that run excellent conferences internationally. But I don't think we have the same focus in our clinical care space and the same ability to bring together the tools and implements people are developing and sharing those or curating them in a way that we can then readily access when we get back home. So I think that's something we could look at.
Well, I tell you, you said you've learned some things and have some things to take back, and I think you've certainly brought some things with you for all of us to think about. And I've really enjoyed hearing the things that you are working with and towards in Australia, and we have a lot of things to think about from what you brought to us too. So it's certainly a two-way street. It's been great having you here.
Well, it's been a great knowledge exchange, and I felt absolutely privileged to be here, so thank you.
So one of the things I like to do on the show is ask guests to tell us 3 things in 3 minutes that you want people to know about this field that you think can improve the world for people with intellectual and developmental disabilities.
Wow. Only 3. Am I only limited to 3? That's tough.
Start with 3 and we'll continue this another time. How about that?
Critically for me, I think this area often sounds complex and overly challenging to those on the outside. I'm living proof that people can undertake a developmental journey in this area and grow in their knowledge and skills and gradually adjust their practice so that they can be doing a better job for people with intellectual and developmental disability. So I'd like to share that you may be interested but concerned or feel overwhelmed as a clinician. I'd encourage you that there are great colleagues to help shepherd your growth and development in the area. And that to me is a real encouragement to be working with like-minded people who are willing to share their expertise so generously and build that capacity. And so as clinicians, you can become confident even if you don't feel competent at this point. I think a second thing is that working in this area requires you to be innovative and to overcome multiple challenges and barriers. We're used to doing that if we work clinically in this space, and we must also apply that to a broader research and capacity building approach. So there's an excitement, I think, in doing that and developing high-level skills that help in addressing that complexity across those different domains. And that's part of the excitement and joy of working in this area. And so I'd like to encourage people who like to think in an innovative way and with complex systems to join the efforts in this area. And thirdly, I'd like to think that people should always have lived experience at the centre of what they're doing. Quite critically, in this area, we don't get anywhere if we go this alone or think that we know. What we must do is know from people with lived experience what their needs are and work with them on solutions. So I think those would be the three key things that I'd like to
those
come across.
are three very important points to make for sure. And I want to emphasize what you said in your first point. You don't have to jump into this and know everything all at once, but you can make small changes if you're a clinician to your practice, making it more physically accessible, understanding or learning just a little bit more about one or two aspects at a time and incorporating those things into your daily practice. And really, it will make us all better clinicians for everyone that we treat when we learn more about this field.
Absolutely. And those very small differences that you can make a big differences to people's lives and improve access to health care and health outcomes. So we must never underestimate the power of making those adjustments.
Well, Dr. Trollor, thank you so much for taking the time to talk with me today and for the work that you do in this field. If people want to learn more about the organization in Australia, how can they find out more?
Easy to just Google either my name or UNSW 3DN. That's the abbreviation for my department, which is the Department of Developmental Disability Neuropsychiatry in the Faculty of Medicine and Health at UNSW Sydney. And that's probably the easiest. I'm very happy to connect with people via email at j.trollor@unsw.edu.au.
Excellent. Thank you so much.
Thank you, Craig.